Welcome to ePathshala. Today we will discuss about public health care in India in this module. I introduce myself as Anita, faculty working as Associate Professor with School of Medical Sciences, University of Hyderabad. Dear students, in this module we will discuss about the public health care in India, about public health system, the Bhore Committee report and functions of primary health center in India. First and foremost, we have to know what is health. Health is not an independent entity and it is not seen in isolation. There is no independent definition of health and it depends on other factors. We measure ill health or disease, which is termed as morbidity or mortality if it results in death. So health, by definition, by the World Health Organization, is defined as health of an individual as a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. World Health Organization, while it defines health, does not define what is public health. We have a model of health here where people are exposed to certain risk factors and at the same time each individual has an inbuilt ability to provide some kind of resistance to any of the diseases. Now, in the absence of the body resistance and in the presence of exposure to several risk factors, it can present as poor health. Poor health manifests as disease condition. If untreated, disease condition may result in disability or in worst case scenario, it may result in death. In public health, we deal with a situation where we promote health and avoid the disease condition. If the disease condition is avoided, the probability or the chance of death or disability can be reduced. Public health is therefore described as the science and art of preventing disease, prolonging life and promoting health of the individuals through organized efforts of the community and by informed choices. Public health deals with group of people rather than individuals. The individualistic approach to health or disease is more driven in the hospitals whereby the physician is treating a disease or a condition of ill health or trauma. In public health, there are several dimensions and it rests on the premise of promoting health, which is popularly called health promotion activities. We prevent disease, there are disease prevention activities, and we believe in early diagnosis and prompt treatment if at all an individual is diagnosed with some illness. Another function is disability limitation and rehabilitation. Let us go back to our traditional approach. The traditional Indian approach to health is enshrined in the concepts and principles of Ayurveda, which means the science of life. Ayurveda is one of the oldest systems of healthcare in the world. It deals with both preventive and curative aspects of health. Health defined by World Health Organization is very similar to the concept of Ayurveda. The Western approach towards health, however, is to avoid diseases, death and disability, which traditionally focuses on personal hygiene and public sanitation. Throughout the 19th century, there were many developments in the areas of personal hygiene and public sanitation, and thus this improved the health condition of people living in the West. This approach was also combined with better food availability, and this paid rich dividends to the people living in developed countries, whereby it reduced morbidity and mortality to a large extent. Let us talk about public health in independent India. The evolution of public health care system in independent India was largely shaped by two important factors. First and foremost was the report of the first Health Survey and Development Committee, whereby Sir Joseph Bhore was commissioned to conduct a study across India during the colonial times. The study was commissioned in the year 1943 and the report was submitted in the year 1946. Second factor was emergence of modern medical technology for the prevention and control of diseases, especially those related to communicable diseases. As I mentioned, Sir Joseph Bhore was appointed in the year 1943, whereby he came up with a comprehensive set of report which recommended remodeling of health services in India. He proposed integration of preventive and curative health services at all levels, primary level, secondary level and tertiary level. He spoke about the hospital-based healthcare system and the development of primary health centers in two stages. He also recommended training in preventive and social medicine for medical professionals. Bhore Committee recommended two plans. One, the short-term plan, whereby every PHC or the primary health center was recommended for a population of 40,000 people. The primary health center was to be manned by 2 doctors, 4 public health nurses, 4 midwives, 1 nurse and other staff, ancillary staff. This was the recommendation provided by Sir Joseph Bhore. The long-term plan was that a primary health unit would be present for every 10 to 20,000 population. This would also have 75-bedded hospital or a healthcare center. He also recommended secondary unit with 650-bed hospital. And he recommended a district unit with 2,500 bedded hospital. However, the recommendations of Bhore Committee and the availability of preventive and curative medical technology resulted in the evolution of hospital-based public health system. The public health arrangements were replaced by hospitals and health centers. Public health services were merged with medical services, and public health was at the crossroads of medical development, advanced technologies, as well as providing services to the large number of population. Bhore Committee recommendations were accepted only partially. One primary health center for every 30,000 population was adopted. There were only 6 beds in each primary health center, 1 medical doctor and truncated paramedical staff. The situation has remained largely unchanged even today. The current public health care in India comprises of primary health care through the primary health centers and the sub-centers. Healthcare is provided through hospitals and health centers such as community health centers. There are rural hospitals, district hospitals and health centers. There is availability of specialist hospitals today. There are several teaching hospitals. Healthcare is also provided through health insurance schemes such as the Employees State Insurance and the Central Government Health Scheme. There are other agencies which provide healthcare such as the Defence Services, the railways. In the private sector, the private hospitals, polyclinics, nursing homes and dispensaries provide healthcare. There are several general practitioners and clinics which mushroom in urban and peri-urban regions. Now, I shall talk about the indigenous system of medicine. The indigenous system of medicine in India comprises of Ayurveda, Siddha, Unani and Tibbi, homeopathy. This is popularly now called as Ayush, with the inclusion of yoga also. There are many voluntary health agencies in the country which provide healthcare, and healthcare is provided centrally through the several national health programs. At the level of the community health center, which caters to a population of 80,000 to 1,20,000 population, currently there are 3,276 community health centers across the country. There are 23,730 primary health centers catering to a population of 30,000 per primary health center. The sub-centers are many. There are around 1,38,000 sub-centers across the country, and each sub-center caters to a population of 5,000 people. There is healthcare provision at the village level. The presence of local dais in some remote rural areas, and there is a Anganwadi worker in every village who provides or prepares nutritious meal. At the village level, there are village health guides, and these are people or persons with an aptitude for social service, and they are not a full-time government functionary. These health guides are mostly women. They serve as links between the community and the government infrastructure. They provide the first contact between the individual and the health system in the periphery. At the sub-center level, one sub-center caters to a population of 5,000 people in general. But in hilly, tribal and backward areas, one sub-center caters to a population of 30,000 people. There are two functionaries at the level of the sub-center. They are the health worker male and health worker female. They are sometimes referred to as multi-purpose worker. These multi-purpose workers are given a training of 6 to 8 months, and they are oriented by the primary health center medical officer time to time. They form the link between the health guide and the primary health center. They are responsible for all health services and programs in that area, and they work under the supervision of an health assistant. Each primary health center caters to the population of 30,000 in rural area. If the terrain is difficult, hilly or tribal, or it is in a backward area, it caters to a population of 20,000. This is proposed for effective coverage of health services in a given geographic location. Let us now visit the functions of primary health center. The primary functions are education in relation to health. Secondly, prevention and control of communicable and non-communicable diseases are the function of primary health center. The primary health center also promotes the provision of safe food supply and proper nutrition. Supply of safe drinking water and provision of basic sanitation is also a mandate of the primary health center. The maternal and child health care services are provided through the primary health centers, and in several places the primary health center is operational 24/7, meaning 24 hours and 7 days a week. Immunization against major infectious diseases is also a mandate of the primary health center. appropriate treatment of common diseases and first aid for injury provision is also one of its functions. At the primary health center, provision of essential drugs has to be made. It is also a center through which several national health programs are implemented as relevant to the geographical location and the condition present among its people. Primary health center provides for referral services. The training of health workers such as health guides, health assistants also happen at the primary health center. Let us now discuss the staffing pattern in the primary health center. At the minimum, there should be one medical officer, one pharmacist, one nurse midwife, one health worker, one block extension educator, one health assistant male, one health assistant female, one lab technician, one driver, and ancillary staff such as attendants. Minimum of 4 are essential for a proper functioning of the primary health center. There are several challenges which exist in recruitment of the staff, in the retention of these staff, and also the well functioning of these staff. At the community health center, there is a proposal where 1 out of 4 primary health centers in the community developmental block has to be upgraded and recognized as community health center. The community health center should have 30 beds with a specialist in surgery, medicine, gynecology and pediatrics with X-ray and laboratory facilities. The community health center covers a population between 80,000 and 1,20,000. Now let us talk about health insurance. There is no concept of universal health insurance in India. At present, the health insurance is limited to industrial workers and their families. There is provision of central government employees health insurance scheme which is covered for all the central government employees and their dependents. Health insurance is an emerging concept in India and there is scope for increasing health insurance. The government provides health insurance at the village level and at various state through various names in the scheme. The Employee State Insurance Scheme is popularly referred to as ESI, which was introduced in the year 1948. There is contribution by employer and employee and it provides for medical care in cash and kind, benefits in the contingency of sickness, maternity benefits, employment injury benefits and pension for dependents on death of a worker due to employment related injury are some of the provisions under the scheme. It covers all those employees whose salary is less than 10,000 Indian rupees per month. It covers all employees, manual, clerical, supervisory and technical under the ESI scheme. The central government health scheme was introduced in the year 1954 in New Delhi. It covers employees of autonomous organizations, retired central government servants, widows receiving family pension, member of parliaments, ex-governors and retired judges. The CGHS scheme covers over 50 lakh beneficiaries through 320 dispensaries or hospitals. There are other agencies which provide health care such as the Defence Medical Services, the Armed Forces Medical Services, health care provision by railways and railway hospitals and clinics provide health care. There is concept of annual health checkups at several of the government organizations. The private agencies are also involved in provision of healthcare, and this is done through private hospitals, independent clinics. Nearly 70% of healthcare is provided by the general practitioners. The private health sector, however, is highly unorganized. It is concentrated in urban areas and it mainly provides curative services rather than preventive services. The Medical Council of India, the Indian Medical Association are involved in regulating some functions and activities of the private healthcare providers. Let us talk about the indigenous system of medicine, which provides bulk of healthcare to rural people in India. There is a National Institute of Ayurveda and National Institute of Homeopathy, and government is studying how such institutes can be best utilized for provision of effective healthcare among people. There are voluntary health agencies in India and they are also involved in the provision of care. Some of the voluntary health agencies in India are the Indian Red Cross Society, the Hind Kush Nivaran Sangh, Indian Council for Child Welfare, Tuberculosis Association of India, Bharat Sevak Samaj, Central Social Welfare Board, the Kasturba Memorial Fund, the All India Blind Relief Society, professional bodies, international agencies. Healthcare is also provided to people through several national health programs. To name a few of the national health programs, there is Anti-Malaria Program, there is National Filaria Control Program, Kala Azar Control Program, Japanese Encephalitis Control Program, Vector-Borne Disease Control Program, National Leprosy Eradication Program, National Tuberculosis Program, which is renamed as the RNTCP, Revised National Tuberculosis Control Program, National AIDS Control Program, National Program for Control of Blindness, Iodine Deficiency Program for Prevention and Control of Iodine Deficiency. There is Immunization, Universal Immunization Program, Reproductive and Child Health Program, and National Cancer Control Program. There are certain targeted areas which the government focuses on, and these are: it focuses on elements of primary health care, it focuses on referral system, provision of comprehensive health care, and addition to the national health programs in areas which were earlier not touched. Now let us discuss about some of the loopholes in public health. One fallout of the hospital-based public health approach was the neglect of public health legislation. A model of Public Health Act was drafted in 1950 by the Government of India. It was revised in 1987. However, this Act is yet to be adopted by any of the constituent states of the country. The hospital-based public health system led to the medicalization of the system. The focus has been on medical services, and public health services have largely been neglected. Poor public health services result in high cost of illness, debility, disability, and death in the population. The main sufferer are the people, especially the poor and the deprived. The epidemiological and statistical dimensions of public health also have been grossly neglected. Lack of epidemiological and statistical database in order to plan and execute any public health program was lacking. In the absence of necessary information, planning is reduced to a normative, mechanical exercise, often out of context to people's needs. The problem gets even complicated because of the social, economic, cultural and environmental diversity that exists in India. This leaves normative planning virtually redundant. Decentralization of health system could not succeed because of lack of epidemiological and statistical information. To a large extent, the National Rural Health Mission accomplished decentralization at the level of the primary health center. The widespread existence of preventable disease and deaths can be reduced by consistent improvement in public health system. The emphasis should be on strengthening public health system rather than focusing on tertiary private healthcare setup. Thank you.